Hi, I'm Dr. Ted Herrmann. I've been practicing for about 25 years. Currently we're in Kendall, and this is Miami, Florida. It's a wonderful place to be practicing. I love Florida. Well, it's interesting how I became aware of the dangers of mercury fillings. It was actually a personal experience. I wound up becoming mercury toxic myself. And it was an interesting story. My wife is the one who actually diagnosed me. She said, "Ted, something's wrong with you." And I wasn't quite so sure what she meant, but being a good husband, I listened to her and I went to my traditional physician, and he promptly told me that I was perfectly fine. At which point she said, "I need you to see a different kind of doctor." And he introduced himself, and the first thing he said, without even examining me, was, "You're mercury toxic." And I just about left the room, but he said, slow down. You're a dentist. You deal in mercury." And I said, "Well, dude, I haven't put that in for years." I said, Great. "Well, how do you take it out?" And that's where my light bulb started to go on. He said, "You need a mask, actually a gas mask." I said, "Do you have one of those?" I said, "Not really." "And what do you do to protect your patient?" And that's where I started to get a little bit upset. I said, "Well, traditional vacuum suction." I said, "No, I'm sorry, that's not quite good enough. You're exposing yourself, your patient, and your assistant." And that's where, I guess you could say, I got a little bit angry at the American Dental Association, and that's where things really turned around. I went back to the office and never been the same. There's so many people out there that are suffering from all these ailments that don't have any idea where it's coming from. Granted, mercury is a huge component of that. It's not the only component. But I have found many physicians who just can't heal their patients. They have no idea that mercury is the issue. So my mission in that sense is to help to bring them into enlightenment so they can get better, so they can heal. I have a patient who I had been bothering for years, so to speak, to remove his mercury fillings. And once we finally got them out, he came to me 3 months later. And he says, "Dr. Herrmann, I have to tell you something." I said, "What's that?" "I've been suffering from ocular migraines for the last 30 years. And I know you've been bugging me to get these mercury fillings out. But as soon as you got those out, they disappeared." And so that's a patient telling me how great the benefits. And of course, the mercury vapors are right next to the brain and the head, and it's kind of a traumatic thing that he went through. But finally, he got them out, and he was doing really well after we got them out. Personal attention for each individual is of paramount importance in my practice. Everyone is very different. Everyone has very different symptoms. Everyone has different needs. I like to believe that we cater to those needs for each individual patient to make them feel like they're part of the family. I really feel that it's necessary, because if I'm going to be helping someone heal, it's not just healing the dentition. That's only part of the issue. There's also a spirituality that has to happen too. It's kind of hard to do that if you don't connect with the patient. So for me, it's part of the whole package. You need to be able to feel that you're in the right place. Feel that this is what you need and I can deliver it to you. More like family thing. The oral cavity, the teeth, that's one component. When I graduated dental school, that was the only component I was concerned about. Until I started to, I guess, hit my head up against the wall, so to speak. We started to fix things and they wouldn't get fixed. We tried to clean up the disease and it wouldn't get cleaned up. Brought my attention to the need that there is, or brought my attention to the fact that there's so many other factors involved, that the mouth, the oral cavity is connected to something else. Oh yeah, the rest of the body. And so if I don't have a good understanding of the rest of the body, how could I possibly attempt, even begin to dream to attempt, to heal what I'm seeing in the mouth? My practice is a healing place because I'm dealing with many different factors, and healing of the tooth, the physical aspect, is probably the easiest part. It's the person, the human being that is connected to that, the emotional and spiritual aspect of the entire person that really needs to happen. I like to believe I can assist in guiding and directing the patient to get to those healing points. When a person leaves my office, I like them to feel that they've been well taken care of, that I've personally attended to their personal needs. We've been able to take care of the Mercury issues as they stand, and perhaps even give them a little bit more guidance to the further healing that is necessary to recover from what they've been through.